All right. Here we go. We'll be talking about the state of universal health coverage in World Health Organization, Africa region, and then we'll be tracking the SDG 3 and exploring innovation and digital solutions. So one may ask, what is the SDG 3 about? We have about 17 SDG goals, but we'll be focusing on the third one, which is well-being and then good health. So our discussion will be around the well-being and good health, and also how innovation and technology would be applied in our healthcare services. We have here CNO Emi Akote. She's the CNO of Nursing Audit Kolebu Teaching Hospital. We also have here, I'll give a full profile about them. Then we also have Professor Bello here. He's also from the Department of the Physiotherapy, UG. We also have Dr. Gladys Bruwa-Nyama, Deputy Director of Medical Training and Simulation Center, UGCM. Now, we'll be heading towards our program. I'll usher them in with a short profile about themselves, then we hit the road. Kindly give me some few minutes. The cultural troop we just saw, they are called Sikako Dan. They are from English Yaman from. They are near the washing bay, the bus stop. So you can kindly contact them as and when you need them. Okay, here we go. A whole lot, pardon me. Okay, so I'll call Mrs. Akote. She's the Chief Nursing Officer and Head of the Audit Unit of the Nursing and Midwifery Directorate, Kolebu Teaching Hospital. She has had this appointment for the past 7 years, having been appointed to this position in 2016 as a Chief Nursing Officer for Nursing and Midwifery Audits over the years. She has gained extensive experience in nursing leadership, quality assurance, and regulatory compliance. She has led and managed the team of nursing professionals to ensure compliance with regulatory requirements. This is the person we will be interacting with. Let's usher her in with a round of applause. Okay, please. Professor Bello. Prof, you are welcome once again. Kindly bear with me. So, Professor Bello, as I call him, he's an associate professor of the orthopedic musculoskeletal physiotherapy at the University of Ghana and a coordinator of the graduate programs in the Department of Physiotherapy. He is a researcher and clinical educator with a vast experience in the design and evaluation of high-quality academic and rehabilitation programs. His research interests include the modification of physical modalities, including the use of technology, in the remediation of impairments within the physiotherapy practice. Also, Professor Bello is a research fellow of the Stroke and Cardiovascular Research Training and a foundation fellow of the Postgraduate Physiotherapy College of Nigeria. He is a mentor of many committees and boards in the University of Ghana and a registrant with allied health professions Council Ghana, as well as a member of various professional associations. Welcome, Professor Bello. She's currently the Deputy Director at the Medical Training and Simulation Center of the University of Ghana Medical Center. She's a public health practitioner with 28 years experience in clinical care, research, training and preventive practice. She holds a PhD in telemedicine and maternal health, as well as master's degree in public health. She is also a state-registered nurse, a midwife, and holds a bachelor's degree in nursing with psychology. Let's welcome her. We are all set to go. Later, we would have a representative from the World Health Organization joining the conversation with us as the panel discussion goes on. I will now call on our moderator for the panel discussion, the General Board Member or Chairman for the Oxygen Health Forum, Dr. Thomas Apostle Nintego Tego, to be with us this morning.
Thank you. Thank you, honorable men and women seated. And thank you, my honorable panelists and guests. I'm so grateful to have all of you, great man and women. It's a pleasure to have me here. I hope you have mics on your... Can we have separate mics, please? Thank you. We all are aware about the issue of healthcare delivery in Ghana and Africa. It's no news to anyone seated here that the insufficiency or inadequacy of healthcare delivery is a problem for Africa and in Ghana in particular. And therefore, Oxygen Health is seeking to bring healthcare delivery to the doorsteps of the citizen. I want to pose my first question, and I believe we normally say women first, today I'll say men first. Professor Bello, how do you perceive the current status of access to healthcare services in Ghana and Africa? And what's your opinion, if any, on what can be done to improve accessibility and affordability? Thank you.
Thank you, everyone, and I'm very happy to be part of this auspicious gathering. I want to start from a positive note. Challenges are there, it's always been there. But let us give ourselves a pat on the back. Government has put in a lot of measures to improve these challenges, even though we are not yet there. Okay, I have stated that. Now, the issue goes beyond accessibility. The availability to are there within the medical delivery services. There are some healthcare delivery services that are not near sufficiency. Talking of assessing it. And there are many factors, these parts of factors that are leading to this. Partly on the part of implementation, because I believe government has a lot of policies in place to address some of these, accessibility issues. But because of implementation, or perhaps because of the barrier to such implementations, we're still yielding in some of these, problems. I'll give you an example. Why it is better for medical and paramedical, healthcare professionals or healthcare professions, it is worse with rehabilitation sciences and other allied sciences. So I think as the discussion goes on, we'll be able to bring in vital information on what and what we can do.
Let me just bring your mind to something. You say that government has done enough by making sure that health is accessible to almost the whole part of the country. How would you take this one as a physiotherapist? Do we have the services of rehab in every part of Ghana?
Capital no.
Okay. So how do you intend to make it available?
Yes. The solution to this problem is not a day job, and that is why I started on the positive note. For instance, when I came to Ghana in 2007, we were less than 100 physiotherapists in the whole country. Today we can boast of 300. Yes. When I came, it was only one institution, that University of Ghana, that is training physiotherapists. Now we have 2.5. So, we have 2 establishments.
But they are not going to the internet.
Okay, they are now. Okay. They are now because the internet and all those things have improved, so people can stay anywhere, make a negotiation and network to anywhere they want to make. But at initial stage, it's very difficult. Everybody wants to remain either in Accra or Kumasi.
So you can agree with me that accessibility is still a problem?
It is. In fact, WHO declared openly in 2016 that there is a large unmet need, rehabilitation needs in the whole world, not even to talk of in a low resource settings like ours. Right? So it's an obvious thing. But that is why it's a build-up discussion. When you continue to raise challenges in all situations, to harness the solution will be a problem.
Okay, thank you, Prof. Bello. Let me come to you, Dr. Akosia Niyama. What's your view on this same question, accessibility to healthcare across the country in Africa?
Thank you. Universal health coverage actually is a big problem in the global area. Ghana is no exception. That is why some implementation related to telemedicine and others were put in place. We haven't gotten there yet. And I'm tempted to say that the public sector is rather doing well than the private sector. And it looks like most people that do have money attend the private sector, leaving out the public sector. This is where the issue is. It looks like if you do not have money, you don't get quality health care. And these are things we have to look at. We haven't gotten there yet, and there are still remedies we need to put in place to achieve some level of universal health care as well as quality health care.
Thank you. Would you agree with me, Madam Amy, that specialist training of health professionals is important, and therefore specialist nurses and midwives as well as other categories of healthcare workers should be available in every part of Ghana? If yes, how do we ensure that?
Thank you very much for this question. Yes, I agree that we really need nurse specialists and especially the trained, those who are trained professionally all over this country. But the question comes again, how do we get them there? When we even look at the funds that we have, looking at their salaries, the motivation comes in. They need to be all over, but they don't have attractive motivation or remuneration to be there. So I think with the limited funds that the government has. Yes, we are trying to have them, we are training, the country is training more specialists. We still need to do something about that.
Touching on that, Rabbi, you're looking at the challenges you face within the health industry, right?
Yeah.
What other challenges can you look at?
The other challenges that we can look at is even limited resources that we have to work with. We can have the specialists all over, but if we don't have the resources to work with, it's like we haven't done anything. So, and also, we still have shortages anyway. So that's one brings in mind that we have a constraint, time constraint. So they don't have even the time because there are so many patients that need to be attended to, but the health professionals are few, and therefore they don't even have time to examine the patient very well. So even though we are training them, we have to look at the resources also.
You are a nurse, right?
Yes,
What do you want to say about the attitude of nurses towards clients on their first visit to the hospital?
That is a good question. Yeah, looking at the attitude of nurses towards clients in the hospital, I would say that it's not all the nurses that have this bad attitude. And now we are even looking into it, and we are seeing that most of them, it's even coming from the homes. Because even the training institutions have to do their best to give them what they need to have, the customer service that they need to give to the clients. And even in the hospital, we are trying to do it. Professionally, nurses are to be nice to patients. It's also part of the therapy.
Let's give it to nurses in Ghana. Thank you. And indeed, Ghana nurses are nice. Looking at the load of work and the numbers. I mean, obviously, when I'm tired in my class, sometimes you find a fun face. It wasn't intentional, but I'm tired and stressed out. Thank you so much. Let's go to Dr. Neoma. Dr. Neoma, you said you have your PhD in telemedicine. How do we ensure digital solutions within the healthcare industry?
Yes, that's I think telemedicine has been piloted in America and we realized that the most of every death was from maternal health, so we implemented that around it.
What is stopping you from doing it more?
It comes, but we just got funds to implement it, so we are setting up strategies to improve it. I think when it is done, at least the general extra, even if you don't get to the maximum, at least you attain some level of good health. And
what are some of the challenges you find potential that will face as people when it comes to digital health services?
when it comes to
Other digital health services,
network issues is one very big problem. I think in relation to telemedicine, the role of the community health nurse at that side is supposed to review and refer to somebody at the district level. Sometimes you even need to send images for the physician or consultant to review and then get back to you. In some instances, you send the file and it does not do. Another one is you even make a call separately and it will tell you, even when the person is closer to you, the network will tell you that the number you have for yes, so that's another one. The second one is about consultation. Access to go was a big problem. Even in the market of where it was started, you only one ad. If you look at the roads, if you are pregnant and you have to be sent to the district hospital to deliver, you might deliver in your car because the roads were very terrible. Yes. So at least network issues and road systems as well as transport. These two things were the issues that we needed to resolve before we do the nation right now.
So you should be calling the network operators.
Yes.
To tell them we are about to roll out telemedicine. They should do up on their day. Thank you. And for fellow, what challenges do you foresee we face in rolling out digital services and even making healthcare accessible across Nigeria?
Okay, thank you very much. We have a subset of the medicine, we call it telerehabilitation, which hold the same principle. And I've been leading this contract for the past 3 years. She mentioned funds. Funding has been the issue. But let's take that out. The digitization of health entails a lot, in particular with this area of the we are in a society where our literacy level is low. So there's a need for enormous support of tech support, literate support of technology and how to use it, apart from the network she mentioned. Then, more critical, most critical, the acceptance of the client in the realm of rehabilitation. I tell you, in physio, we make maximum contact with the patient. And what they do is with the research that we carry out is that patients even near the facility of our topical care is a therapist of people. That you actually want to come, and I'm sure you know that the best therapist, the best nurse, the best doctor is the one who can actually bring patient at home. That is sitting in front of the physiotherapist or sitting in front of your doctor, your problem is 50% solved. If you are meeting very good,
for the benefit of people who are watching this across the globe and in Ghana, I want you to highlight some of the problems that physio tends to solve when it comes to healthcare. What are some of the things you do? Areas of care that will pass physiotherapy.
Okay, so physiotherapy follows the same path as medicine. What I mean by that is that medicine, there are areas of specialty. I sit down before you this morning as an orthopedic physiotherapist. We have O&G physiotherapists. We have those who specialize in bends and plastic. Madam here is one of them. We have those who specialize in stroke, neurology generally, cerebral palsy, children who have delayed development, and so on and so forth. And we have those who are in sports, who deal with sport. So under these branches I give you, there are a whole lot of conditions that I may not be able to exhaust.
When you go to rural areas in Ghana, there are persons who are also undertaking physiotherapy informally. How do you hope to rope them in for training like we've done with the TBAs?
Excellent. We had that division in the University of Ghana. In my department, when I was the head of the Department of Physiotherapy, we scout for some of these home-trained therapists, because massage is as old as man. Okay, so what we now realize is that, okay, these people are doing human job at community level. We can't rubbish them. Why can't we invite them to give them some rudimentary training? And that's what we did. So we did that for almost 3 years consecutively until we were not getting, applicants again. And one of them who came for that program actually saw a whole lot of things they are doing very wrong, and they embraced the one they think they have been doing very right. So we have even gone ahead to do that, to correct all the anomalies. For instance, those who are following our athletes, they can cut the careers of our athletes short if they manage their injuries very wrong. So at the University of Ghana, we are back on this program to make sure that for all those informally trained health workers are actually brought to limelight.
Thank you. Let me go to Madam Amy. We find today within the media landscape, and I have particularly referred to TV, you have every kind of person calling himself doctor of herbal medicine. You tune your TV, and they mention leaves and everything, as if they are filling in a gap that the orthodox trained practitioner is not found in. So everybody is becoming a herbal practitioner today, and they are all about parroting their cures. Do you think it's going to be a problem going forward when this gap is not filled immediately, based on the challenges you face as health practitioners?
This is going to be a very big problem. It's already a problem. And I think we need to look at our health promotion area in our public health sector, so that we will also go on advertising or educating, that's the right word, educating our people. Because if the people don't have the right education, then these ones who are always, they are all over, even in the cars, they are there. Immediately you enter a car and you sit down, the next thing after the good morning, they have something for all of you. And they do it with passion. So I know that legally, we the healthcare workers, you can't do that. But our health promotion units need to do something about
So do you see a shortfall with health promotion education within the MOH and DHS in Ghana?
Yes.
How do you solve that?
Yeah, solving that is, once we have recognized it that it is a problem, then we need to improve on our health education. And have more people to train to do that and give them the authority to do health.
Thank you, sir. Dr. Niyama, would you agree with me that pastors cover a long range of people, pastors and teachers, and that it's important that the Ministry of Health involve them in health education and empowerment of our masses?
Seriously, it's an area I wouldn't like to venture.
Why?
We have full trust in them. Seriously. Their members do have full trust in them. And whatever they say, that is what the members do. That's why I said it's an area I do not want to venture.
Okay.
However, if you are able to capture the head, the head, you may want to train them, and then they can influence.
So you don't want to talk to them yet, educate them, empower them?
Because I think they listen to them more. Some of, even the women, they adore the pastor than their husband. So I think they can do it.
All right. On that one also, you are looking at Oxygen African Health Forum today. And today is fast forward, the World Health Organization celebration day was supposed to be last week Friday. But because of the Easter holidays, we brought it this far. What is your message for the whole world on the World Health Day?
This is a dream come true. That is what I would say. It's a dream come true because I have experienced telemedicine and I know the effect it brought on board, even in Amazon Western. So I was happy I saw digital health work. Initially, it was quite difficult as to the content is going to present. But a quick review indicated that we are on the right route. So let's embrace it, partner with others who are already on board, so we can hold it up and then push it to the highest level.
Thank you. Same question to you, Professor Bello.
Yes, I think I also agree that's the right step in the right direction, because with digital health, we are able to navigate the geographical barrier and the partly financial barrier. I couldn't say that fully because it's not being implemented to actually know whether tele-rehabilitation in my own case will be more cost effective or will be equally cost effective, like in-person care. But whatever the case, I think by whole assessment, I think it's a right step in the right direction. And there are, like I said earlier on, there are other policies in place that are running. Usually it's always the implementation that's the problem. For instance, community health planning and services. The essence is to empower people, to break most of the barrier, to increase, to improve the access. It's already in the system. Okay, so we can use all this digital health, and which the Oxygen Health Forum has already started. Combine it with what we have in the systems to improve our lives.
Thank you. Madam Amy, your take on World Health Day and then celebrating Oxygen Health?
Yes, it's a step in the right direction. All that I want to say is that let's invest in that. And I think we will do very well in achieving the universal health coverage.
I am honored to have hosted you, great men and women within the industry of healthcare in Ghana. And in our tradition, you don't invite someone in your home and just let them go. So let me rise up and say thank you for coming. Thank you for coming. And thank you for coming. And to all of you who watch us, we are grateful you are part of this discussion. Soon it will be your time to also ask questions and you have answers from our panelists. Thank you so much. MC, I hand over to you.